my name is Jenny. I'm a nurse practitioner student at the University of Memphis. I will be doing a head-to-toe assessment today on my patient Kyle. First, we are going to do a scan of the room. I'll scan behind my patient, the floor. This is our assessment table. My supplies, my Snellen chart, the floor around me. That's where we're going to be setting up the camera. Now. So today is January 22nd, 2024. And I will now start my exam. We will be inspecting the head for size, symmetry, and midline. I'm going to be inspecting the scalp for hair color, hair texture, hair distribution, any masses, lesions, depressions, infestations. I'm inspecting and palpating. I'm then going to palpate the temporal artery for any tenderness. I'm going to palpate the lymph nodes, starting with the preauricular, postauricular, occipital, tonsilary, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. I'm going to palpate the masseter muscle. And I'm first going to palpate about TMJ, looking for any crepitus, any subluxation, or tenderness. I'm going to palpate the masseter muscle and get the patient to clench his jaw. That's assessing cranial nerve number 5, the motor function of that. I'm now going to assess the sensory function of that. I'm going to get you to close your eyes and let me know where I touch.
Forehead, nose, right cheek, left cheek, chin.
Okay, great job. And now I'm going to assess cranial nerve number 7, which is the facial nerve. I'm going to get you to smile, frown, raise your eyebrows, pucker out your cheeks, and pucker up your lips, puff out your cheeks. That's checking for facial symmetry. I'm then going to assess the outer ear, inspect it, looking for size, symmetry. I'm going to come around and palpate the pinna and the tragus for any tenderness or masses. I'm going to inspect the auditory canal and tympanic membrane, ensuring for patency and that the tympanic membrane is pearly gray on both sides. I'm going to assess, that came apart. I'm going to assess my patient's hearing by doing a whisper test. I'm going to come around here. I'm going to get you to cover up your right ear. I'm going to whisper.
1, 2, 3.
The other side.
1, 2, 3.
I'm now going to do the Weber test, which tests for lateralization. Can you hear that equal on both sides?
Yes.
Okay. I'm going to do the Renee test. I'm going to put this on the mastoid process and tell me when you can hear it. And now?
Yes.
Okay. This is making sure that air conduction is greater than bone conduction and hear it.
Yes.
Okay. I'm going to inspect the brows, lashes, and palpable fissures. I'm going to inspect the conjunctiva and sclera for any color, discharge, or lesions. I'm then going to assess cranial nerve number 2, which is the optic nerve. I'm going to get the patient to look at that chart. I'm assessing for gross acuity vision. Can you read cover up the right eye and let me know what line you can read.
FELOPZD.
And cover up the other eye.
FELOPZD.
And read it with both eyes.
FELOPZD.
Okay, 20/20 vision. I'm now going to get you to face me. I'm going to check peripheral and central vision. Let me know when you can see my fingers.
No.
Okay, and then I'm going to check ocular motor nerve, which is cranial nerve number 3. I'm going to check for pupillary response is consensual to light. I'm gonna grab my working one. Alright, pearlet is intact. I'm now going to check for, you can turn towards me. I'm going to test for accommodation and convergence. Well, find you a place to stare at on the wall right there, and then follow me in. Alright, that accommodation and convergence is intact. I am now going to assess the consonant gaze with extraocular movements. That is assessing cranial nerve number 3, 4, and 6, which is the ocular motor, abducent, or trochanter, and then abducens. I'm going to get you to follow me for me in all 6 visual fields. Okay, great job. I am then going to get my ophthalmoscope. I'm going to look for red light reflex and internal structures of the eye. I'm looking for any internal, any nicks or wool spots. Follow the red light reflex in. I'm going to do that on both sides. Look for the red light reflex, move in. Okay. No wooks, no nicks or wool spots noted. I'm then going to assess the nose and make sure that it is straight and midline position. I'm going to assess the cranial nerve number 1, which is olfactory. I'm going to get you to close your eyes for me and tell me what you smell.
Orange.
Okay, I'm going to check for nasal patency, if you will. Blow out on each nostril, cover one and the other. I'm going to palpate for tenderness in the maxillary and frontal sinuses. I'm going to move around back to you. I'm going to assess the neck. I'm going to palpate the trachea, make sure that it's midline position. Raise your neck up for me. I am then going to assess the thyroid gland. Look towards that way for me. And then this way. Okay, I'm also going to palpate the carotid artery for pulsation. I'm going to auscultate the carotid artery for bruise with my bell. All right. I'm then going to move along, and I'm going to assess your mouth. I'm going to assess the lips, teeth, gums. Can you open your mouth for me? Lips, teeth, gums, tongue, under the tongue, buccal mucosa, the salivary glands, the soft palate, the posterior pharynx, and the tonsils. If you have any tonsils, I would assess those at this time. I will then do cranial nerve number 9 and 10, which is the hypoglossal and the vagus nerve. I'm going to make sure, get the patient to say, ah. I'm making sure that the soft palate and uvula rise with phonation. I'm then going to get the patient to stick their tongue out. That's cranial nerve number 12, which is the hypoglossal, or just the glossopharyngeal. Sorry, glossopharyngeal is cranial nerve number 10. Stick out the tongue, make sure it's midline without fasciculations. And then I did the neck, and now I'm going to move along. I'm going to get you to turn your back to the camera, please. I'm going to assess the posterior chest. I'm assessing for any respiratory distress, which is use of accessory muscles, tripod positioning, nasal flaring, retractions, cyanosis, or tachypnea. I'm going to inspect for any obvious deformities and then make sure that it's symmetric. I'm palpating for chest expansion. Please breathe in for me. And then I'm going to palpate for tactical fremitus. Say 99.
99, 99, 99.
And now I'm going to percuss in the intercostal spaces. I'm then going to auscultate in the the posterior chest, I'm going to start over the scapula and rotate from side to side in intercostal spaces, going down into the lung bases with my diaphragm. Take a deep breath in each time my stethoscope hits your back. All right, I'm going to do the lateral, left side. The right side has 3 spots, left side has 2. All right, I'm then going to do agnophony. Say E when my stethoscope hits your back.
E, 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 E.
Bronchoscopy. Say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Whisper pretrocralowy. Say whisper 1, 2, 3. Okay, if you'll turn around towards me, I'm going to look for any, inspect for any obvious deformities and look at make sure it's symmetric. I'm going to palpate for chest expansion. Breathe in for me. I'm going to palpate for tactical firmness. Say 99.
99, 99, 99.
Now I'm going to auscultate the anterior chest. Just breathe in when I touch your chest. Okay, I'm now ready to move along to the heart. I'm going to listen with my bell and diaphragm in each 5 points of the heart, each 5. So aortic, which is the second intercostal space on the right side. Pulmonic, which is the second intercostal space on the left side. Erb's point, which is third intercostal space on the left side. Tricuspid, which is the fourth intercostal space. And then the mitral, which is the 5th intercostal space. And now I'm going to do my bell. Aortic, pulmonic, Erb's, tricuspid, and mitral. All right, I'm then going to identify and palpate for the PMI. Right now, I would listen to the apical pulse for 1 full minute. For the sake of this video, I will not do it for 1 full minute. I will just say that the rate is 76 and the rhythm is normal for the sake of time. I'm now going to get the patient to lie down at a 45-degree angle is what we would want if we had the capability. I'm going to assess for JVD and jugular pulsation. I'm going to get you to look that way for me. And then this way. All right. And now I'm going to redo the auscultation of the points with my diaphragm and bell with the patient sitting down. Well, before I auscultate, I'm going to inspect for any hives or lifts, and then I'm going to palpate for any heaves in each spot. Aortic, pulmonic, Erb's, mitral, or tricuspid, mitral. Now I'm going to auscultate with my diaphragm and bell. Aortic, pulmonic, Erb's, tricuspid, and mitral. And then with my bell, aortic, pulmonic, Erb's, tricuspid, mitral. Now I'm going to inspect the abdomen for any contours and make sure it's symmetrical. I'm going to listen to the arteries. With my bell, I'm going to listen for any bruits. Aortic, renal, iliac, and femoral. to listen in all 4 quadrants of the abdomen. Now I'm going to percuss in each, and then I'm going to palpate in each quadrant. I'm going to palpate the spleen. I'm going to move around and palpate the liver. I'm going to put my hand right here so that you can see me. Alright. Now with that done, I'm going to get you to face your back to the camera for me. Right now I'm going to percuss for CVA tenderness. Any tenderness there?
No.
Alright, now you can turn around towards me. I am now going to move to the musculoskeletal. I'm going to inspect the joints of the hands, wrists, elbow, and shoulders. I'm going to be inspecting for any redness, swelling, deformities, any crepitus, nodules, any pain, and make sure that it is symmetrical on both sides, any tenderness. Alright, I'm going to check for capillary refill in the fingers, and I'm going to assess the radial pulse. Alright, now we're going to do some range of motion tests with your joints. Starting with your fingers. Alright, I'm going to do flexion, extension, hyperextension, abduction, adduction, thumb opposition. I'm going to do your wrist, flexion, extension, hyperextension, ulnar deviation, radial deviation, and rotation. Flexion, elbows, extension, start that over. Flexion, extension, hyperextension. And that's just turning that. And then I'm going to do your shoulders. Flexion, extension, hyperextension, adduction, adduction and abduction, circumduction, internal rotation, external rotation, and on the other side. Okay? Now I'm going to test the strengths. I'm going to get you to squeeze my hands. There we go. That's a 5 out of 5. I'm going to get you to flex and extend against resistance. That's checking the strengths of your bicep and tricep, and flex against me. Okay, and on this side. Okay, and then now I'm going to assess the shoulder girdle by getting you to abduct and adduct against resistance. Okay, and now I'm going to do a shoulder shrug against resistance. That's assessing cranial nerve number 11, which is the accessory muscle. And there we go. And then I'm going to do a few tests. I'm going to do a few cerebral movement function tests with rapid, fast movements. I'm going to do the serial finger test. I'm going to get you to put your fingers to your thumbs. Each finger, okay? Now I'm going to do the fast flip-flop hand. If you will, just put your hands on your thighs real fast like me. And then now I'm going to do the finger opposition. This is a finger to finger test. Put your finger to my finger and then to your nose. And do it with the other finger to your nose, back to my finger. Okay? And then now I'm going to do strychnosis and graphesthesia. I'm going to get you to close your eyes. This is strychnosis. I'm going to get you to let me know what I put in your hand.
Keys.
Okay, let's do the other one. What I put in your hands. Okay, good job. Strychnosis. I'm going to do graphesthesia. Just let me know what I write in your hand.
3.
What letter am I writing?
T.
All right. And then going to do assess the color and temperature, warmth, skin integrity, edema of the lower and upper extremities, looking for any edema or any breaking in the skin. I'm going to do a sensory soft touch, or so, tell me if you feel it, it's just a sensory light touch sensation test on your lower and upper extremities. Let me know what you feel, if it's soft or hard or sharp.
Soft, soft, soft.
Okay, I'm then gonna do a vibration sensory test. All right. Well, I'm gonna do it on the ulnar prominence. You feel that?
Yep.
And
Yeah.
And I'm gonna do it on the medial malice. And feel that?
Yep. Yep.
Okay. And now we're gonna test your deep tendon reflexes. Stick your hands out. I'm gonna do the radial brachialis for the deep tendon reflexes. Get mine. Okay, I'm gonna do the bicep. Tricep. And patella. Posterior brachial. Posterior tibia. Okay. And then now I'm going to do Basinski's. Alright. We now will move along and we will assess the joints of the feet, toes, ankles, knees, and hips. I'm going to assess for any redness, swelling, deformities, any tenderness, crepitus, making sure it's symmetrical. I'm going to assess the capillary refill in each toe. I'm going to assess the radial pulses, posterior tibia, alright. Now we're going to do some range of motion tests with your toes. Do what I do with my fingers with your toes. Extension, flexion, extension, hyperextension, adduction, abduction. Okay, and then now we're going to do with your ankles, dorsiflexion, dorsiflexion, plantar flexion, eversion. No, eversion's out, inversion's in. Do it with both feet. All right, and then we're going to do rotation. Okay, and then now I'm going to check the strengths of your feet. I'm going to get you a dorsiflex and plantar flex against me. And then I'm going to get you to flex and extend against resistance, testing the elbow strengths. And then abduct and abduct against resistance. With your hips, that's checking your hip strength, that's 5 out of 5. We're now going to check the range of motion. You can stand up of your, we're going to do your hips first. So flexion, extension, hyperextension, abduction, adduction, circumduction, internal rotation, external rotation. All right, now we're going to do the same thing. Flexion, extension, hyperextension, abduction, adduction, circumduction, internal rotation, external rotation. All right, good job. And then we're going to do your knee. Flexion, extension, hyperextension, flexion, extension, hyperextension. And then now we're going to do your, we did your hips. So now we're going to do your cervical spine. I want you to bend over for me. I'm looking at the curvature of the spine, ensuring that it is straight and midline. And then I'm going to get you to, and looking for any scoliosis. Now we're going to check the range of motion in your cervical spine. So flexion, extension, hyperextension, lateral fixation, circumduction. All right, and then we're going to do it in your, that's your lumbar spine. Then we're going to do your cervical spine, flexion, extension, hyperextension, lateral flexion, side to side. Okay, and then rotation. All right, and then now we're going to do Romberg. Just stand with your hands out in front of me. Okay, I'm gonna get you to walk straight for me, and then walk back, and then do the tandem gait, and then hop on one foot. All right, that concludes our assessment for today.